Hi, my name is Katie Colin. I work with the WSMA and I'm here to help address some of the concerns and questions and benefits with the health insurance exchange. The Affordable Care Act will help increase access to coverage of health insurance in Washington State in possibly two ways. The first way is through the health benefits exchange, and the second way is through potentially an expansion of Medicaid. The health benefits exchange will be available for folks who are above 133% of the federal poverty level to access federal subsidies to help with the purchase of private insurance coverage through the exchange. It's estimated that 280,000 folks will take up that opportunity to purchase coverage in 2014, and by 2017 we're looking at a possible 470,000 folks purchasing private insurance coverage through the exchange. That includes individuals and small businesses. The health benefit exchange in Washington State is called Washington's Health Plan Finder. The Health Plan Finder is intended to provide access for those Washingtonians who are currently under or uninsured in Washington State. The Health Benefits Exchange, Washington's Health Plan Finder, will provide access to insurance coverage for individuals and small businesses through the access of federal subsidies to help with the purchase of that coverage. The second option might be taken up by the legislature in the 2013 legislative session, and that is the expansion of Medicaid. Currently, Washington State covers up to 100% of the federal poverty level for folks on Medicaid, and Washington State has the option to expand up to 133% of the federal poverty level. From 133%, that's going to be single adults without children who currently are uninsured in Washington State. That will be funded primarily with federal dollars. For the first few years, Washington State will be covering 10% of that bill, and the federal government 90% starting in 2020. Ultimately, the expansion of Medicaid could open up access to insurance coverage through Medicaid for about 260,000 Washingtonians. A grand total of roughly 600,000 new folks covered in Washington State with some form of insurance coverage after the 2014 legislative session. The development of the health insurance exchange in Washington State will impact physicians. We know that through the creation of the health insurance exchange, we're going to be bringing on roughly 300,000 folks who have otherwise been uninsured or underinsured onto the insurance coverage rolls in Washington State. We also know that there are provider shortages in certain areas of Washington State. Most of that shortage falls in rural areas, and those shortages will be exacerbated by the addition of 300,000 people. You also can't look at the exchange by itself. You also have to look at it in context with a potential expansion of Medicaid, which will bring on roughly 300,000 additional folks to have a grand total of roughly 600,000 new covered lives in Washington State. So that's 600,000 folks who will be seeking access to care, and the question remains as to whether or not we have enough physicians and enough providers at large to address that additional capacity. Physicians in Washington State support greater access to care, but access to health insurance coverage is not necessarily the same as access to care. We know that there are going to be numbers of physicians in Washington State that are not enrolled in participating in products sold through the exchange. And we want to make sure that the physicians that are enrolled in the products sold through the health insurance exchange are sufficient to meet the demand for treatment and actual access to care.